Hi, and welcome back to the next season of Frank and Mary here in Hudson. If you haven't seen this show before, my name is Art Bergeron. My day job is as an elder law attorney at Myrick O'Connell. There are 70 of us at Myrick O'Connell, and therefore everybody gets to do what they like. I do nothing but elder law because I'm getting old, and I like dealing with people who are older. But this show is not about law; it's about my friends Frank and Mary. If you've been to the presentations I do at the senior center, you know that Frank and Mary have three kids, Peter, Paul, and Mary Jr., and their goal is to live in their house until they die and be buried in the backyard. And if you're Frank and Mary and you're living in Hudson, your goal probably is to stay right here for as long as you can and possibly until you die. And so the question that we're always asking ourselves in these shows is who are the people you need to know and what are the programs that you need to know about in order to do just that, in order to be able to just stay home, or if you're not staying right at home, being close to home for the rest of your life. So I have had Doug Peck on before as a guest because Doug is and Doug, thank you very much for being willing to
You're welcome.
come on this for this show.
Hmm.
And because Doug has been working now for a lot of years with a group called Seniors Helping Seniors, and I'd like him to talk to you about that because I have found this to be a unique. Um, it's hard to call it a home care agency because it isn't like other home care agencies.
Hmm.
But I'd like Doug to talk to you about that. And Doug, talk about Seniors Helping Seniors and kind of what all of that is about, and then maybe we can talk about kind of what is going on now.
Hmm.
How you adapted to COVID when COVID was in. Now COVID is, we thought back July 4th that we put it in the rearview mirror, but it's feeling like it's catching back up to us.
Right.
And so maybe we can just kind of talk about that. So
Hmm.
can you just kind of start off by talking about, your involvement with Seniors Helping Seniors and what all of that is?
Okay. Yes, I've been involved with Seniors Helping Seniors since 2011. So it's actually been 10 years now that I've been involved with it. It's a franchise. I own the franchise that was based out of Southborough and covered all of the Metrowest area.
Mm-hmm.
Um, Since then, in late 2017, I merged the franchise with our Boston area franchise, which is technically based in Waltham. So we now cover the greater Boston and Metro West area.
I see.
Um, it's a unique business model. It's one of those ideas that come along where you say, boy, I wish I had thought of that because it's simple and it works so well. Um, the difference between our agency and other home care agencies is that we employ only seniors as our companions or our caregivers. And so they're not CNAs. We don't do personal care. We don't do medical care. We address a couple of really important issues. One is socialization, keep getting people out and back into the community again, or just having someone coming into their home or facility if that's where they are, and being what I would call like a friendly neighbor with them. Someone you can talk to, someone who has had shared experiences because of their age, and grown up in the same basic time frame as the people that we take care of. It just works so well that we have a lot of demand for our service now because the last year or two has isolated so many seniors. And loneliness is really a big health risk right now. It's almost as much health risk as going out, into the world. But we've been very, very cautious at Seniors Helping Seniors. All of our companions are vaccinated. And because we're dealing with just other seniors, they've all been vaccinated as well. And they tend to not get out very much anyway. They get out on occasion, they go out and mingle, but they're also very careful about what they do. So we've been very fortunate to be able to have a good, stable group of folks that I don't think anybody that's worked for the organization has contracted COVID.
Right. So Doug, can you, once again, for people who are hearing about this for the first time, and that, that often happens, that and
Hmm.
that's one of the reasons I wanted to have you on the
Right.
show, because I think I do know a lot of people in Hudson. I do a lot of work in Hudson. But I
Mhm.
think this is a really important piece of kind of the mix if you are a senior in Hudson. So can you talk a little bit about who the people are who tend to be your clients, and
Okay.
also who the people are who tend to be your workers? And
Right.
we're not talking about volunteers here. You're talking about
Right.
people who are actually who are getting paid to provide these functions. So
Right.
could you talk about each of those?
Sure. And it is a paid position. It's a regular, as we call W-2 job. People work anywhere between 10 and 12 hours a week up to some work just about full time for us. Um, but they are folks that our age probably starts around 50 for us and goes
Yep.
on up. I've had people in their early 80s that have worked for us. So it's a wide range of folks. Um, they're not professional caregivers. When I started this business, I was not a professional caregiver. Still don't consider myself a professional caregiver. Um, it's really a worthwhile job because you're giving back. You get really good feedback all the time. Our clients really appreciate um, what we have to offer. Our clients are folks that uh, may be at home. My very first client that I had was a woman in Natick who was 90 at the time. She lived with her daughter, but her daughter worked in Boston and didn't want to leave her 90-year-old mother home alone all day. What do you
Right.
do? She had some memory issues. So we would take her out to lunch every day so the daughter didn't worry about having to rush home at 6:30, 7 o'clock at night and feed the mother, who by that time was, that's
Right.
long past where she would want to have dinner.
Right.
And she was getting socialized. She was getting out. She loved to go out for riding in the car. We took her all over the place, and and we stayed at the house with her, depending on what she wanted to do. Uh, but she had somebody there for 3 or 4 hours every day. That was her social activity.
And,
So,
and that's probably like a really good example, because
mhm,
you've got a person who is, I want to say, otherwise healthy. She has some
mhm,
issues. She has some
right,
issues that a lot of older people do. Maybe she had some memory issues, right?
mhm,
Um, um, but she was not driving,
right,
and that's like one of the, just for people who have grown up in a suburban environment, where and driving is everything, to be not driving. A lot of so I'm a person that loves driving, right?
yeah,
I just like driving.
yeah,
I still drive. It's amazing to me. I still drive over 25,000 miles a year. I think,
wow,
my wife has a car that's 11 years old and she's driven 75,000, and I have one
yeah,
that's like 5 years old and I've driven 150,000 miles.
yeah,
But I know I would miss that.
mhm,
It's just the satisfaction of driving. So to even to have that ability to just drive around, or to be having somebody who can just come in, just to have somebody that you feel comfortable with,
right.
just to talk to, is just like
Well,
that's a
that's
big deal.
that's the other piece, and she's a good illustrator of what our whole program is about. We had the same caregiver going back for uh, 4 years with her.
Yeah.
We had actually two because they would switch off.
Yeah.
But so you go to the same person, you really get to know them. One of the other things that she loved was dogs. And she used to have dogs, but now she can't go out and walk the dog anymore. The daughter's not around. But one of my caregivers had two older dogs. She would bring them over. They would sit out in the backyard, throw the balls to the dogs. The dogs would be running around. She had a great time because she got to see the dogs. Some days we'd go over. She wasn't feeling well. Again, she was in her early 90s. Um, she'd be laying on the couch. One of the dogs would get up and lay with her. I mean, it was such a sweet thing to see. One of my caregivers volunteered at a place in Framingham called Eastleigh Farm.
Oh
And
yeah,
it's a
yeah.
big farm that has a lot of cows there. Well, she was volunteering over there one day a week or one day every 2 weeks. She brought her over to the farm. Well, when you're 90, guess where you spent a lot of summers? At a farm, you know? So to her go over there, uh, she would help feed the new calves. Just the whole smell of it, being in a barn again, brought back these really great memories. It was really uh, a great event for her. She just remembered that. She just really loved going to the farm. The people over there got to know her as well, and she had a great time. Now that's something that normally, a traditional caregiver would never do.
Right,
You wouldn't even
right.
think about doing something like that or bringing your dogs over. So we do this as there are so many instances like this.
So Doug, and I think when people are hearing this, it especially kind of rings true if you're a person who is alone, right?
Right.
But I remember you once telling me about, so I'd like you to talk about people in two different circumstances. I
Okay.
remember you talking to me about a woman who was actually with her family,
Mhm.
but it was the kids and the grandchildren, and she was in the house, but it was just their world was just kind of spinning around her, so she just
Yeah.
really needed something. And then, in an earlier show that you and I did, which is what one of the reasons I was interested in having you on,
Mhm.
you were talking about providing caregiving actually in one of the area assisted living communities, which I
Right.
never would have thought about. So can you
Right.
talk about those kind of situations?
I can. The first one you talked about was actually a neighbor of mine. She lived in Southborough, and one of the newer homes, beautiful home. She also had grown up and lived in Southborough, but her husband had passed away, and it didn't make sense for her to be living by herself uh, in this big house in Southborough. So she moved in with her son, who at the time had two teenage boys in the house. One was in middle school and one was in high school. So you know all the activities that they're involved with. So they're constantly on the go. Uh, the wife had a big professional job. She was out most of the time, and he was working. He was self-employed and working at home. I would go into the house, and it was really pretty chaotic. But she was there. But as you said, what she really was alone because everybody else was so involved with what was going on. I brought two caregivers in. One lived in Ashland, one actually lived in Southborough. Um, the biggest thing was it was coming around the 1 year anniversary of her husband's passing. And she was, feeling pretty lonely and pretty depressed.
Right.
It turns out both of the people that I brought over were widows themselves. So for the first time, she had somebody to talk to about what she was going through. This is the 1st year anniversary, what it was like to be, to have him pass after all the years. And both of these women could appreciate it. They've gone through the whole process before. They became very close. One was very Catholic. She was very Catholic. And so they would sit and listen to Mass together, uh, 1 or 2 days a week. Um, and it was just a really great way. She got so close to them and felt very much more not as lonely.
Right.
She had been seeing a Jerry Psych person, had been on antidepressants for this. And after just a month or so, they cut those way back, the drugs needed, because she just felt, a part of something. She had somebody to talk to who had actually gone through it. And now, if you think about it, you really can't talk to your kids about what you're going through as a
No.
widow, you know. Uh, so it was very hard for her because she was isolated. She was there in a beautiful place, but she really felt lonely and very isolated.
And now on the other side of that, talk about the folks that you see who are in. We were talking about folks that you see among other places like New Horizons, which is close. Many people in Southborough are aware of New
Right.
Horizons. which I think is, I've always told people, if you're
Mhm.
seeing assisted livings, among others, you have to see New Horizons.
Right.
It's the oldest one in the area, and it's just a really terrific model,
It, it
right?
is it is a nice
But
facility.
it's big. I mean, when we were just talking to the director,
Right.
and she was saying there were 400 people there. That's a lot of people, right?
It is a lot of people, and
So I wouldn't think you'd
they do
lack
a
the.
wonderful job. I actually have one client that I still see there right now,
Yes.
and it's a good example. Her daughter is still working and lives in Manhattan, and she's the only really living relative, and
Yeah.
she's up here. And so I take her to a lot of doctors and dentist appointment. She's pretty hard of hearing, so I'm often in there with the doctor or the dentist, explaining things to her. We've been doing it now for a number of months. I know all her doctors. I
Right.
know her. I can talk to her about this is what the doctor recommends. This is what he's saying, etc. Uh, but two other things happen. One is we often go out for coffee afterwards. So we're sitting outside. We go to the Law Shoe
Yeah.
in Marlboro, and the first time
Is
I
that
did
for,
it
is
was a
that for
little.
coffee or for a beer, Doug?
We only go for coffee,
You only go for coffee. Okay. Just checking.
but it was a little chilly out. They have a nice little fire pit that we sit out there. But she said to me, says, it's so nice just to be normal again, just to sit with somebody and have a cup of coffee, and just talk about things in general. You
Right.
know, it's and to get outside, the fresh air. So, it's something I look forward to. She's still a big reader, so I would bring her over some books. We would talk about books. Um, I'm actually now in the process of uh, the daughter's going to buy her a Kindle.
Yeah.
And I'm going to show her how to be able to use the Kindle, download books, etc., because she is a pretty voracious
Right.
reader. In talking to her as well, she has a hard time on the phone, but it's the only way she can communicate with her daughter because, the daughter calls all the time, but she has a hard time on the phone.
Right.
So, because I'm involved with so many different people in the senior care community, I put them in touch with a free service called Caption Call that it will now, you can see what the person is saying on your phone and respond back. And again, it's a free service from the government. And she just told me the other day, it's the best thing for her because now she can talk on the phone with her daughter, really catch everything that she's saying
Right.
because she can read it. So again, it's just another, way we interact with people who are either at home or in their or in any of the either independent or assisted living facilities.
Now, Doug, you're describing this, and I'm saying to myself, boy, if I were looking for somebody, I want Doug Peck, right?
Mhm.
So, because it kind of goes back to an earlier question. So,
Right.
so tell me about the people, like what the people who are working there now, right?
Mhm.
And whom you, because to some
Right.
extent, the people you'd want. For the people who are working there, like what did they do before? What is there kind of a common denominator as to who who
I
shows
think
up? Are they all like you? I mean that, right?
I think they're all what I would call people persons.
Hmm.
And we also look for what we call sort of the heart of a volunteer. A lot of them have volunteered. They volunteer at their place of worship. They volunteer at schools. They do other things, but they like being out and they like helping people. They could be uh, former salespeople. We've had people that have worked in retail. We've had nurses. We've had people, I'm telling you, from every kind of walk of life. But right now, they're not ready to sort of just completely retire. They want to get out. They feel that they still have something to give. And by giving, we talk about people who are lonely in facilities or even at home. But a lot of times, people who are still relatively active in their late 50s, early 60s,
Yeah.
if they're no longer working full time, have lost their social network.
Right.
So by going out and working, with other people, it gives them a reason to get up in the morning, to get dressed, to put on sort of a happy face, to go out there and help somebody else. It's really very rewarding for them and they become part of our community. We right now have about 140 people that work for us. And so we do a lot of things. We have book clubs, we have movie nights, we do a lot of things. So the
You do a
people that
lot
work for us,
just among the
just
employees.
among the employees, now have a whole new social network, again, of sort of like-minded people. They might come from different, backgrounds and experiences.
Yeah.
Some are living in the city, some are living in the suburbs, but the commonality is that they enjoy the work that they do. They enjoy helping other people and other seniors in particular.
And I suppose if they're involved in that big a network, once again,
Mhm.
I'm thinking of it from the you'd like to see some more people, right?
Right.
From that perspective, it's also making them better at doing what they're doing, because I'm sure that you're constantly
Right.
hearing the stories, the good stories, the bad stories. Inevitably there are some bad stories,
We are.
about how, or just different situations, and how
Mhm.
how you can react, the different options for reacting to different situations, right?
We have a great team of people in the office that, we have seen so many clients, hundreds of clients now over the years, that we sort of have a pretty good answers to just about any situation. Can really be able to advise families and help them along, because it really does take a village. When you're trying to take care of somebody who is older. I mean, that's how I started when my father passed. I was the closest uh, and oldest to her. She wanted to stay at home as long as she could. And so for 4 years, it was doctor's appointments. It was, finding people to mow the lawn and to shovel the driveway. And I mean,
Right.
the list goes on. So I know firsthand how complicated, it can become for folks to do it. And the key is, don't do it alone. you know, and you can start small in any situation. Uh, One of my longest term clients, we started 1 day a week, 2 hours a day. She was very reluctant to have someone come into her home. But because we really try hard to find a good match, bringing somebody in that's going to be a good match for the personalities involved, um, she ended up staying at home for a long time. But we were doing 24/7 with her after a few years because of her health. In this case, it was her mental health that had deteriorated.
Right.
She was
Right.
physically still fairly good, but she just couldn't stay home alone anymore. It was too much of a danger for her to do that. And we kept her that way for probably over 2 years until she moved away with her daughter in another state.
Right.
You know,
And I
but
suppose in that kind of situation, I mean, you never know, but had it not been for the seniors helping seniors person there,
right,
that whole thing might have broken down much more quickly. If she,
much more
if she
quickly.
didn't, because if you don't have that confidence in the people who are coming in, and so
Right.
you're just imagining, oh my God, you're thinking all the bad things that could be
Hmm.
happening, if there's somebody coming in, and how is that all going to work out? She probably just would have rejected that.
Right.
Right. Whereas
So
this gave her this kind of like a runway to
yeah,
living an additional 2 years in her home, which I'm sure she liked.
right.
Right.
Absolutely. And everybody gets medical complications. I mean, I had clients that have had knee replacements or hip replacements. So we're there to help them. We work closely with PT people and OT people. Again, we're not the experts, but we can, no one likes to exercise alone, right? So if you have your PT exercises, our folks will do them with you. They'll say, okay, it's time to, do your
Right.
chair exercises,
Right.
get up, get down. Most people don't even like to go out and walk alone. And walking, as we know, is a really good exercise for seniors, but
Yeah.
people are afraid to fall. Um, I had a client at a beautiful facility that had beautiful pathways. It's at over where Cushing Hospital is in Framingham. It's a
Mhm.
beautiful park there. But she was on a walker and wouldn't go out because she was afraid if she fell, who would know? So we would just take her out for walks every day, sit on the bench, walk some more. I mean, it was a great exercise for her, fresh air when we could do it. Um, and it really helped her assimilate into the community.
Right.
You know? So there's
So
a
I
lot
guess
we can do.
there's a lot that you can do. And so I guess, Doug, I would really appreciate it, and for the folks who are watching, I'm asking Doug,
Mhm.
to get his contact information to the folks at HUD-TV.
Okay.
So, so if you've got any questions, you should talk on both sides. If you think
Right.
that this might be worthwhile for you, right?
Mhm.
Or for your mother or your father or whoever, right? Or
Right.
if you feel that you have the time and
Mhm.
have an interest in this, and you look at Doug Peck and you say, yeah, I'm kind of like him,
Mhm.
I could really enjoy this, right?
Yeah.
Because as I always, whenever I'm talking to seniors, I say, that a crucial piece of being a senior is that we have to be helping each other out here,
We
right?
do. Right.
Because inevitably we may be needing services later on. So it's
Mhm.
really important that we kind of evolve this network
Mhm.
that can help others and then ultimately can help us. And interestingly, I think seniors helping seniors is the one kind of home care, quote unquote, entity that is a vehicle for doing that, because it's
Right.
getting seniors really involved. So Doug, I really appreciate it. I really appreciate you doing
Thanks
this.
for having me out there. I appreciate
Yeah.
it. Yeah, and we are actively hiring, and we're in the Metrowest area, keep you close to home, uh, and it really is nice to be able to help. What I consider to be a neighbor, somebody in your close community.
Right.
Stay independent and stay healthy.
Right. It's great. So Doug, thank you very much, folks. If
You're
you
welcome.
enjoyed it, I hope you enjoyed the show. Contact these people, not when it's an emergency. Well, I mean,
Right.
you can, but try to contact them so that you know that this is a resource that's available to you,
Right.
that it's available to you. So thank you for watching. We look
Yeah.
forward to seeing you next month in the next installment of Frank and Mary here in Hudson. Thank you very much.
Take
Thank you.
care.